Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Thanks for tuning in again and welcome to episode number 61, How to Recognize Bladder Disorders in MS with the help of a simple questionnaire. Today I would like to introduce the MS Bladder Check tool, which was developed by a team of neurologists, urologists, and rehabilitation specialists. It is designed to enable rapid management of bladder dysfunction caused by multiple sclerosis. Bladder symptoms occur in a high percentage of MS patients, although the figures vary in different scientific sources. For many MS patients, problems begin within the first 5 years. However, until now, the symptoms of around half of people suffering from bladder disorders have not been treated. This is why the international team of experts from 9 different countries has developed a simple questionnaire that patients can fill out while waiting for their appointment with a neurologist or MS nurse. The aim is to treat bladder disorders as quickly as possible, preferably when they occur, so that quality of life remains at a high level. The Bladder Disorder Questionnaire. The paper by Professor Dr. Peter Flachenegger and others contains 9 questions that give a fairly good initial overview of whether a person has bladder problems. There are 3 possible answers, either yes, no, or don't know or not relevant. Professor Dr. Peter Flachenegger leads our Module 5 of the Multiple Sclerosis Management Master's Program, which focuses on symptomatic therapy. He is chief physician at the Quellenhof Neurological Rehabilitation Center in Bad Wildbad and one of the leading rehabilitation experts in Germany. Here is a questionnaire. Number 1. Does the number of times you urinate per day impact your daily life? Number 2. On a typical night, do you have to get up more than once to urinate? Number 3. Do you often experience feeling the urge to rush to the toilet to urinate? Number 4. Have you experienced urinary leakage within the past 6 months due to an urgent need to urinate? Number 5. Do you experience urinary leakage during any kind of physical effort, e.g. walking, coughing, sneezing or standing? Number 6. Do you have difficulty starting to pass urine? Number 7. Do you experience weak stream when passing urine? Number 8. Do you experience having to pass urine again shortly after you have urinated, i.e. double voiding? Number 9. Have you received any antibiotics for a bladder infection within the past 6 months? If you answer yes to at least one of the questions and feel that it is affecting your life, you should speak to your neurologist or MS nurse. If you are unsure of the answer, please speak to your neurologist or MS nurse to clarify whether your situation is a yes or no. What I like about the questionnaire. The questionnaire is easy to understand and uses normal language instead of medical terminology. 9 questions are easy to answer. It doesn't take long, and even a person suffering from fatigue will probably be able to answer it in time before entering the doctor's office or the MS nurse's office. The small sketches are an additional help to understand the questions properly. Filling out a questionnaire can be an easy first step to start the conversation about bladder disorders if you are embarrassed to talk about it at all. And please remember that a bladder disorder caused by multiple sclerosis is not your fault, and you should not be ashamed of it. The tool is very time-saving, and the questionnaire can be handed out at any regular appointment. In this way, both newly diagnosed patients and people who have been living with MS for many years can be assessed. Regardless of whether the symptom is new or has been present for a long time but has not yet been treated, all patients can be scanned and treated if necessary. By the way, the small sketches you can find in the show notes or on my blog. Why is the treatment of bladder disorders so important? Bladder disorders can have a variety of effects on a person's life. If someone suffers from incontinence, he or she may withdraw from social activities, such as meeting friends or playing sport, for fear of leaking urine in public. This is certainly an additional psychological burden. If sleep is disturbed because you have to go to the toilet at night, this can affect other symptoms such as fatigue or cognitive impairment. Rushing to the toilet can increase the risk of falling, and these are just two possible negative consequences. Remaining urine can cause bladder infections and bladder damage. In the worst-case scenario, the backlog can even damage the kidneys. Bladder infections are not good for general health and well-being. They can have a negative impact on the progression of multiple sclerosis. Leading experts such as Gavin Giovannoni explain that every piece of the puzzle that can be positively influenced helps to reduce a person's disease burden. Treating bladder disorders and preventing bladder infections is one such piece of the puzzle. Status of the MS Bladder Check tool. At the moment, May 2024, the MS Bladder Check tool has been developed by experts with the help of MS nurses and small pilot trials. It will be tested in a larger cohort in the UK. Once this trial has been successfully completed, it will be promoted to patient organizations, specialist MS outpatient clinics, and via social media. The questionnaire will also be translated into other languages. I asked Professor Dr. Peter Flachenegger if it is okay to talk about it now at MS-Perspektive, and he agreed as the scientific work has been completed. If you think from the questionnaire that you have a bladder disorder that should be investigated and treated, please talk to your neurologist or MS nurse. If you are interested in the full paper, you can find it on PubMed. The full name is MS Bladder Check Tool, Development and Validation of a Patient Awareness Tool to Facilitate Timely Management of Lower Urinary Tract Dysfunction due to Multiple Sclerosis. And the authors are Peter Flachenegger, Bertil Block, Gianpaolo Bricchetto, Yaleshen Panikar, Veronique Fay, Kim Bundvik-Barken. Just a final statement from me. Please take bladder disorders serious, as they really can have a bad impact on your life. And it is absolutely good treatable. There are many options. So if you feel there is something, please talk to your neurologist. By the way, next time there will be the first episode about a dedicated disease-modifying therapy, and it will start with dimethyl fumarate. So please tune in again and hear you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. Hear you next time.